Hydrocele. Does every hydrocele require surgery? Definitely not. So what is hydrocele? Hydrocele is basically accumulation of fluid in the scrotum. In and around the testis, in between the many layers of the testis, a fluid accumulation happens. So that's called, in simple words, a hydrocele. So hydrocele may be mild, moderate or gross hydrocele. A mild hydrocele or even sometimes moderate hydrocele may not require a surgery, whereas gross hydrocele, because of its effect or compression on the testis or because of its heaviness, a person may require surgery for gross hydrocele. So when does this hydrocele happen? It can happen due to some parasitic infections or maybe idiopathic, there is no specific cause, or maybe due to some infection, a reactionary hydrocele can form. And these hydrocele due to some infection are usually very mild in nature. They usually subside with antibiotics. A hydrocele will not lead to any cancer, but yes, early or a late cancer may have small or a mild variety of hydrocele. So what are the complications of hydrocele? Sometimes this hydrocele may become bigger in size and may cause pain. So pain is one, and the pain may not subside with medications. Second is this hydrocele, the fluid or the water, may become infected and may turn into a pus. It may lead to pus discharging abscess, which means that pus may start pouring out, or you may start getting a severe skin infection because this pus is pouring out, and so on. You shouldn't be worried whether the hydrocele can lead to cancer, definitely not. But yes, somebody who has cancer may have mild forms of hydrocele. So what are the different options for getting this treated? Like I said, mild, moderate hydrocele do not usually require treatment. They can just be observed. Gross hydrocele, yes, we do get an ultrasound scan to make sure that it is not a hernia, and yes, it is an hydrocele. And usually surgery is the option for gross hydrocele, wherein we open the scrotum sac and then we identify that layer of the testis which is secreting more fluid. So that layer is usually cut and then the stitches are closed. So usually it's either a daycare or maybe overnight admission. The next day the person is discharged, and maybe rest for 2 to 3 days, and then you should be good to go. And we advise not to have sexual activity for at least a 10 days time. So overall, the surgery as such is it's not very major surgery, but yes, do consult the urologist or an andrologist to make sure that it is a simple hydrocele and not something complicated.